A number of scientists and researchers believe that those who have folds or diagonal lines on the soft part of their ear, called the auricle, are signs of heart disease. Hello dear friends. In this video, we are going to examine the scientific research that links the diagonal line on the ear to the existence of heart diseases. If you like this topic, watch the video until the end, because in the final part of the video, I will explain to you the most important symptoms of heart disease based on scientific research. Have you ever noticed the lines on the earlobe? Did you know that these lines may be signs of heart risks? Well, let's take a brief look at the medical world and the details of this symptom. For the first time, in 1973, Dr. Sandra T. Frank identified the presence of folds on the eardrum and its connection to heart disease in patients under 60 years old who had chest pain. In a study published in 1973, Dr. Frank showed a strong connection between this symptom and heart disease. But what is the mark of Frank? Frank's sign refers to a diagonal line or deep crease in the earlobe, named after Dr. Sandra T. Frank. He first identified this fold in patients under 60 years old who had chest pain. Interestingly, celebrities like Steven Spielberg and George W. Bush also suffered from this symptom. But how could these folds be linked to heart attacks? Arteries, which are always supplying blood to the heart and ears, when damaged, lead to skin folds. One theory states that these folds are formed by the loss of elastin and elastic fibers in the earlobe, similar to damage to blood vessels in heart disease. Well, let's refer to some other research related to this topic. In an article published in the Journal of the American Heart Association, it was shown that people who have more signs of aging in their appearance, that is, more wrinkles on their skin or face, may be at a higher risk for heart diseases. Also in 2016, a study was conducted that showed that the diagonal line of the earlobe is directly related to coronary heart disease. Also in 2017, studies stated that this symptom can also predict brain problems. But unlike the articles I mentioned, in a number of other articles, it was found that there are no exact and 100% mechanisms between Frank's sign and cardiovascular health. But I will explain to you 3 important symptoms below, which are definite signs of heart problems. Accumulation of orange-colored fatty nodules on the hands, knees, and upper eyelids that can be caused by high cholesterol levels. High cholesterol is one of the main risk factors for arteriosclerosis or hardening of the arteries, which can lead to heart attack or stroke. Clubbing of nails. Clubbing of the nails, in which the end part of the nail becomes rounded, curved and raised, occurs when the tissues do not get enough oxygen, for example, in cases such as heart failure. In this case, at the end of the fingers, small vessels are created as a compensation, and as a result, the nails become thicker and wider. Or around the iris. The 4th sign is the presence of a halo around the iris of the eye. A buildup of fat can create a grey ring around the outer part of the iris. The presence of this grey ring occurs abundantly in elderly people and can be caused by heart disease. In general, the presence of a diagonal line in the earlobe may act as a risk marker for heart disease. If you or someone close to you has this symptom, it is recommended to consult a doctor. If you enjoyed this video, be sure to like it and share it with your friends. Subscribe to the channel for more health videos.